If you're on Ozempic, Wegovy, Mounjaro, or any GLP-1, at some point you're going to feel something unexpected. And the question almost every patient asks in that moment is the same. Is this normal, or is something actually wrong? That distinction matters more than most people realize. Because I've seen patients push through symptoms they should have called about, and I've seen patients panic over things that can be completely fixed with slight adjustments. Both are problems. Hi, I'm Philip Marks, head nurse practitioner at Regenics in Tarzana, California. I help people like Camille, who lost over 60 pounds on a GLP-1 treatment with us.
It's just been really a magical experience because I'm getting help and I'm getting that one-on-one attention that I need, but I'm so glad I've gone to Regenics.
And in this video, I'm going to give you the clinical framework I use to separate the side effects you can manage at home from the ones that require medical attention. Not a general list, but an actual decision framework. So when something happens, you'll know exactly what to do with it. The framework. Before we get into any specific symptoms, one principle that changes how you interpret everything. Most GLP-1 side effects fall into two categories. Adjustment symptoms. Your body responding predictably to a medication that's slowing digestion, altering gut-brain signaling, and shifting metabolic patterns. These are uncomfortable. They are not dangerous, and they typically resolve with time and the right behavioral adjustments. Signal symptoms. Your body is telling you something specific has gone wrong that needs clinical eyes on it. These are less common, but they're the ones patients miss because they assume everything falls into the first category. The mistake most people make is treating every side effect as either totally fine, just push through, or this medication is destroying me. But reality is more specific than that. Side effects you can manage at home. Let's start with the adjustment symptoms. These symptoms are the ones that are expected, manageable, and don't require a call to your provider. Nausea. The most common side effect across all GLP-1 medications. Nausea happens because these drugs slow gastric emptying, and food moves through your digestive system more slowly than before. That slower transit creates pressure and discomfort, especially early in treatment or after a dose increase. What makes it worse? Large portions, fatty or greasy meals, eating too fast, and lying down after eating. What actually helps? Smaller meals, protein-forward food choices, eating slowly, staying upright for 1 to 2 hours after eating, and cold water with electrolytes when plain water feels unappealing. In most cases, nausea improves significantly within 2 to 3 weeks at any given dose. If it's not improving after 3 weeks, that's worth a conversation. Not because it's dangerous, but because there are clinical adjustments that can help. Constipation. Also extremely common and directly related to the same mechanism. Slower gastric emptying means slower transit throughout the entire GI tract. Here's a straightforward solution. Adequate hydration, 60 to 80 ounces daily, consistent fiber intake built in gradually, daily movement, and if needed, a soluble fiber supplement like psyllium husk. 1 tablespoon in water daily makes a significant difference for most patients. What I tell patients to avoid: increasing their dose when they're constipated. Fix the gut environment first, then speak to your provider if a dose increase or decrease is necessary. Fatigue and low energy early on. This is counterintuitive to most patients. I'm eating less and I'm more tired? Yes, usually. In the first few weeks, appetite suppression often leads to unintentional undereating. Calories drop, protein drops, and electrolyte balance shifts. The body responds with fatigue, brain fog, and low energy. Not because the medication is causing damage, but because it's running on insufficient fuel. Fix the nutrition and the fatigue usually resolves. Food aversion or taste changes. Some patients notice that foods they loved before suddenly smell or taste wrong. Others find that certain foods become genuinely unappealing. This is a real physiological effect. GLP-1 medications alter reward signaling pathways connected to food. The brain's response to high-fat, high-sugar foods changes. For most patients, this is actually a sign the medication is working. It's not damage. It's a shift in how your brain processes food reward. Reflux or burping. Slower gastric emptying increases intragastric pressure. More pressure means more opportunity for acid to move upward, especially when lying down, after large meals, or with certain foods. How to manage it. Try smaller meals, avoiding food within 2 to 3 hours before bedtime, and reducing high-fat and high-acid foods. If reflux was already a problem before starting a GLP-1, this is worth mentioning to your provider at the start of your treatment, not after it's become a significant issue. Hair shedding. This is one of the most emotionally distressing adjustment symptoms, and one of the most misunderstood. Patients assume the medication is damaging their hair. In almost every case, it isn't. What's happening is telogen effluvium, a stress response to rapid weight loss, low caloric intake, and nutrient shifts. The body temporarily deprioritizes hair growth when it's managing a significant metabolic change. The cause is nutritional, not pharmacological. Adequate protein, iron, B12, zinc, and vitamin D are what hair growth cycles depend on. When those drop, which they do when patients are eating significantly less, shedding follows, usually 6 to 8 weeks after the nutritional gap began. First, fix your nutrition, then do lab work here with us at Regenics and correct what's missing. Hair typically stabilizes and recovers, but only with proper support. Side effects that need medical attention. Now the other category. These are less common. I want to be clear about this before moving forward. Most patients never experience any of them, but these are the symptoms I need patients to recognize because early identification changes outcomes. Severe or persistent abdominal pain. Mild GI discomfort is normal, but severe abdominal pain that doesn't resolve, especially pain that radiates into the back, is accompanied by nausea and vomiting that won't stop or that feels like something is acutely wrong. This is not a GLP-1 adjustment symptom. This pattern is consistent with pancreatitis, which is a rare but serious complication associated with GLP-1 use. Do not manage this at home. Do not wait to see if it passes. If you're experiencing severe, persistent upper abdominal pain, especially with vomiting that isn't stopping, seek emergency medical support or call your provider immediately. Sharp pain in the upper right abdomen, especially after eating. Rapid weight loss, independent of GLP-1s, increases gallstone formation risk. GLP-1 medications are associated with reduced gallbladder motility, which compounds that risk. Upper right quadrant pain, particularly sharp pain that occurs after fatty meals, or pain that radiates into the right shoulder blade, could be the classic gallstone presentation. This needs imaging, not observation. If you're experiencing this pattern, contact your provider. Don't assume it's standard GI discomfort. Sudden vision changes. There is an emerging and still evolving association between GLP-1 medications, specifically semaglutide, and a rare condition called NAON, non-arteritic anterior ischemic optic neuropathy. The research on this is not settled. The absolute risk appears to be low, but sudden changes in vision, blurring, partial vision loss, and changes in one eye that weren't there before always warrant immediate medical evaluation. This is not a monitor and see situation. Sudden vision changes require same-day or emergency assessment regardless of what medication you're on. Severe dehydration. Significant nausea and vomiting, especially combined with diarrhea and low fluid intake, can create rapid dehydration on a GLP-1. Signs include dizziness when standing, dark urine, inability to keep fluids down, and rapid heart rate. If you're vomiting repeatedly and can't hold down water, this requires clinical intervention. Oral rehydration has limits when GI function is compromised. Any symptom that feels qualitatively different. This one is harder to define, but clinically important. There is a difference between I feel off and uncomfortable, which is adjustment, and something feels acutely wrong in a way I can't describe. You understand your body best. If something feels distinctively different from the general GI discomfort you've been managing, trust that instinct and call your medical provider immediately. The decision framework. When a symptom shows up, run it through these questions in order. Is this something that started recently after a dose increase or a dietary change? This likely only needs an adjustment. Modify the behavior first. Has it been getting gradually better over 2 to 3 weeks? Continue managing. It's resolving normally. Is it getting worse despite behavioral adjustments? Contact your provider. Something may need to be modified clinically. Is it severe, sudden, or accompanied by symptoms that feel out of proportion? Do not wait. Contact your provider or seek urgent care. This framework covers the majority of situations patients actually face. GLP-1 medications are among the most effective metabolic tools we have, but they're not side effect free, and pretending otherwise doesn't help anyone. What helps is knowing the difference between what your body is adjusting to and what your body is asking you to address. Most of you will experience symptoms that fall into the first category. Knowing which is the difference between staying consistent and missing something important. If you have a symptom you're unsure about, that's exactly why we're here. You can reach us at Regenics.com or book a consultation for a full clinical review of where you are in your treatment. And if this raised questions about specific side effects you weren't expecting, the previous video goes deeper into the strange and unexpected things GLP-1 patients experience that most providers never mention. It goes into things like taste changes, fatigue that doesn't make sense, and hair shedding that shows up weeks after it actually started. Watch that next. Because the more you understand what your body is going through on this medication, the better equipped you are to actually stay the course. I'm Philip Marks, head nurse practitioner at Regenics. See you in the next video.